the sugar tax you're justifying on the basis of a fight against obesity, correct?
That's right.
All right. Now, is it fair to say, in your medical opinion, that there's a lot of people that drink sugared soda that aren't obese?
Certainly, yes.
All right. So by an obesity tax, what we're doing, without even getting into the issue of jobs and companies losing business, you're actually requiring people who make right choices in life. Maybe they might not be obese because they work out, or they might not be obese because they drink in moderation. You want them to pay the same tax in order to fight the obesity of those who make other choices.
The correlation between sugared beverage consumption and obesity, both for children and adults, is so tightly connected that, in a sense, the tax scales itself very well, that it's the heavy users, the heavy overconsumers that have the obesity problem, and they'd be paying the taxes and having the behavioral changes.
So should we have a tax on supersized double cheeseburgers with fries?
Sugared beverages are really just sugar and water. They're truly empty calories, and I think that's a good target for a tax approach. As you get into snack food, fast food, junk food, these are complex, and I think the governor's proposal for calorie posting is a better approach than trying to get into the individual components and quantities in other foods. But a soda is water and sugar, empty calories, and it's a very pure target for that kind of a tax.
Isn't what people eat a matter of choice?
Well, it's a matter of choice, but the problem is the market is mispricing sugared beverages. The price of a sugared beverage doesn't include the subsidies that we give to the corn and sugar producers, and it doesn't include the downstream costs of obesity and health care. And frankly, if the price if sodas were not mispriced, if we weren't introducing moral hazard into this, you could let the market work. But the market's failing on sodas.
And where did you get your doctorate in economics?
I studied like anyone else, and if you want to look at the economic models, you can. But that's the way pricing and
are we pricing in the price of supersized double cheeseburgers, the various factors as far as subsidies to people who raise beef, or people who grow potatoes, or whatever the components are of that meal that people choose to have and affects their health?
I know you can provide complications and red herrings, but again, this is an issue that's ripe. It's ready. It's focused on a single agent that is highly correlated with obesity.
Are people morbidly obese because in many cases they don't get exercise?
Exercise probably contributes in the neighborhood of 20% of the obesity problem, with excess calories in the 80% range. It's mostly overconsumption. We all consume more than we did 30 years ago.
Should we tax people who don't exercise?
Again, I'm saying it's a minor contribution, and I don't see a model that would
work there. And 20%'s minor, in your opinion?
It's certainly not the 80% that overconsumption contributes.
Do you agree with the approach that insurance companies have, that where they give a free health membership if you buy their insurance, so to encourage people to make the right choices and to try to stay in shape rather than be morbidly obese?
There's a lot of incentives you can put in favor of those kind of behaviors, and I think that's excellent. Certainly with our subsidized or fully subsidized health insurance models in our Department of Health, Medicaid, we're not able, and when we wouldn't get a friendly audience to implement something like that.
But I'm not talking Medicaid now, because it's not only the Medicaid recipient that's going to be taxed on the sugar. I'm just asking you whether you agree with that concept.
Well, in concept, but I'm also very concerned about insurance mandates, that every time we mandate something else from an insurance company, we drive up the costs across the board.
Well, there's insurance companies that are doing it now that aren't mandating it.
Again, if they make it as a good business decision, that's terrific.
Okay. But you're in favor of that good business decision?
I would like to see their models. Is it a good business decision?
Why don't we get right to the problem? as opposed to trying to go indirectly through tax on this or no tax on that, or you determining what the economics of things are, or the legislature making determination. Why don't we, I got to ask you one thing first. Do people on Medicaid, for example, are they entitled to an annual physical?
Annual physicals are not really a standard in health care anymore.
So the answer is no?
They're entitled to necessary services, but the concept of an annual physical at most stages is no longer a recommendation.
Okay, why don't we just tax people that are morbidly obese?
I take exception to that.
I'm saying we want to get to this goal where we want to stop obesity. We want to stop obesity. And in many instances, there's things beyond people's control, but I'm talking about morbid obesity. And
So, Senator, you would say that the 35% of children who are overweight or obese and highly overrepresented in minority and low-income populations, the answer is more taxes there?
I guess my point is, don't play the minority card with me, because it ain't going to work. My point is simply this. If obesity is what we're trying to correct, to me it's a shotgun approach to charge people taxes who are not morbidly obese. I went to the gym this morning. It's a pain in the neck every morning to go out for an hour. I'd rather sit on my couch and eat some chips and watch television. But I have made certain choices in my life, and I could drop dead tomorrow from something else. But the fact of the matter is that it offends me to provide taxes, to use taxes as a means to try to control behavior, and you are the one who chooses what taxes that you think are important to change people's behavior. If the problem is obesity, there's got to be a way to put a tax on an insurance policy if you're morbidly obese, require certain things to be done if you're on Medicaid, that one of the rules is you gotta exercise now and then if you're morbidly obese. Doesn't that directly arrive, or let me give you a better one. If we get stamps for food stamps, and people can use those food stamps wherever they want, we want to fight obesity. Why don't we use our money a little bit better? Why don't we provide that these food stamps are for only certain foods that are wholesome, they have nutritional value, and they're going to help that little kid, the poor little minority kid that you're concerned about. Because the only choices that are going to be had from those food stamps are good choices. Wouldn't that be a more direct approach?
We've done that with programs like WIC, where we can control the food availability. There are people looking at the federal food stamps program and starting to advocate for exactly those things. Again, it's one of those federal policies that has to be looked at. But I agree about steering people towards good choices.
Well, what policies could we in the state implement that move more towards dealing with the problem directly?
Well, I think our improvements to the Women, Infants, and Children Nutrition Program was an excellent one. Our other departmental hunger prevention programs go exactly along those lines. We provide vouchers for people to get fresh fruits and vegetables in farmers markets to supplement the food packages.
Could the state of New York be a leader in a movement with the federal government to push for a program that's not just with WIC, but the overall food stamp program? If we're really concerned about obesity, isn't that a much more direct and more effective approach than to pick and choose whatever the beverage of the day may be, or whatever the food stuff of the day may be, and tax them in an ad hoc manner?
The one doesn't preclude the other. To rationalize this whole food market all the way from farmer subsidies on downstream, I think would make a great deal of sense, and I think we'd love to participate in that. But at the same time, we have an opportunity here for a triple play: reduce obesity, save healthcare dollars, and generate some money for the healthcare system. And I don't see a better opportunity in this year to accomplish something.
And a quadruple play to tax people that don't have the problem that you're trying to rectify.